bone.
Yeah.
So you came in with bleeding, I guess, right?
Yes.
All right. How long has that been going on?
It's been going on for quite a while. Here in the last 3 weeks. It's been getting worse and worse.
Okay. All right. Anything other than that going on lately, new or different, or everything's about like it's been?
I just had a reaction to my medication or something this morning. I don't know, I think I'm allergic to it or something.
What kind of reaction did you have?
I can hardly talk now. It's got you grab me in my throat. And I can hardly talk.
He said it feels like a block of air was caught in his throat, and they put oxygen back on him because it dropped down to 91.
What did he take?
The only different thing he's took since he's been in the hospital was Tylenol. And Dr. Jabali looked up, and she was going to stop the spironolactone because she said that's one that could cause your tongue and stuff to swell and feel like that. And then I told her about the Tylenol was the only new thing else he was taking there.
Look your mouth in the line. Doesn't look like he's okay. Doesn't look like he's got that kind of problem. That's what you're making. I mean, you can get what they call angioedema, but that doesn't look like what he's got.
Okay.
Take a deep breath for me. Lean up just a little bit so I can listen to your lungs here. Deep breath for me. Pull it out. In. Good. Keep going. Good. Yep, like that for me. Let's take a look at your tummy.
I got a good kind of rash on the side, all these red spots all over me on both sides. And that means my skin starts crawling and everything.
Have they been there a while?
Yes, sir.
He had a few, but in the past week they've been coming out, like popping out more.
When was the last time they drained out of you the fluid out of your tummy there?
Let's see.
Sunday night, Monday morning.
Monday morning.
And it was like time as he drank something, it started swelling back up.
Okay, Dr. Gauls, you called us to talk. Okay, to talk with everybody here.
Yeah.
You know, they found out you had a tumor in your rectum there,
Yeah.
causing the bleeding.
Sit down.
He did not feel like, you know, that you would be able to tolerate surgery for that.
Yeah.
Felt like, you know, you'd be high risk to have any sort of surgery. So
Yeah.
if you can't have surgery for that problem, then that's extremely difficult, if not almost impossible, to get rid of it, okay?
Right.
So there's certainly things you can do to shrink it down, okay?
Okay.
And he asked us to see you along with the chemo doctor. I'm not sure if the chemo doctor has been here yet or not.
And
The oncologist doctor, the lady doctor, she
Dr.
came by.
Bijwa,
Yeah.
okay. So Dr. Gauls was asking if they thought Dr. Bijwa could give some chemo and I could do some radiation to try to shrink it down. So, but again, that is unlikely to get rid of the problem unless you can eventually resect it. Okay. He also has a spot in his liver, and it's unclear whether that might be spread from this, could be a primary liver tumor, or it could be benign. So we don't know what that is. It sounds like Dr. Bajwa wants you to talk to another group of doctors
Palliative care.
to discuss that option. So,
She says she feels that if his situation, that if y'all was to try radiation or chemo, that it would bring him down quicker. And she says she don't feel that it's gonna be the cancer that takes.
sure. I mean, he does have liver disease,
So
but right now he's got the spot down there which is bleeding, okay, and it's actively bleeding, and unless you do something, it's going to continue to actively bleed. So that's the other thing. But you can certainly talk to the palliative care team and see what they say.
So what would you to stop the bleeding, what would be your?
Well, I think, with radiation, you could certainly, I think shrink that down and try to improve the bleeding, okay? Now, whether you could, it would certainly shrink better if they had some sort of chemotherapy with it, okay? No question about that. So, just radiation by itself, I mean, you can certainly have some impact, but it would not be long lasting. But probably do something to improve that in the short term. But again, it's not going to fix the problem.
Yeah.
And at some point, it would start probably bleeding again. Now, you just don't know how long out that would be. And obviously, any kind of treatment does have some side effects and potential toxicity associated with it.
Okay.
And one thing I got is that laxative I take for my
For
What is it?
cirrhosis.
cirrhosis. I take that laxative is what I call it. I pronounce it. And that just goes right through me like water. And the way I'm bleeding already, and being able to do whatever comes about, whatever y'all come up with, this is what I'm here to follow up on. To the best of my ability, what I know how.
Well, like I say, there are going to be a couple options going forward. We can do something sort of on a palliative basis, to try to stop the bleeding there. Or you can have the discussion with, the palliative care folks. Dr. Pavi is also a chemo doctor. She's seen Bajwa and you.
Does he see Bajwa?
Evidently, she told me the female cancer doctor came by, so.
Pregnant? Yeah.
So that's what I saw the name up there, but
I
she
saw,
already saw him today.
Yeah. Well, she came in and talked to us today because she saw him yesterday and we missed her. So she came back today to talk.
Oh, so she did see him.
so I saw your name on the consult sheet and her name on the
Yeah, I was
consult
looking for her consult. I didn't see
I
it.
didn't see him.
What did she tell you on?
She told us that with the small lesion on his liver, it was real small, and they, with it being so small, they would usually go in and take it off. But with him having a bad liver disease, he wouldn't stand for that.
Right.
And plus, with him already, the next thing would be a liver transplant, but since he's got other cancer, that knocks him off of that. And that she was saying call in palliative care because she was afraid that radiation or chemo would bring him down quicker. And she said she was more concerned of the liver disease taking him than the cancer.
I would totally agree with that.
Yeah, I mean, I agree. I don't think that's what's going to kill him, but he's actively bleeding. And
Yeah,
apparently
the only thing I
bleeding
think you
but
could do is radiate him by itself.
I told him we could do that, or if you thought he could take the load or anything like that, but
No
he can't
chemo
take
with
any
his
chemo.
liver like that.
Okay, I mean, I could certainly just radiate it 300 times 10, shrink it down, but like I said, we're not talking, as we said, we're not talking about getting rid of it, I'm talking about trying to
Yeah,
stop
stop
the
the bleeding.
bleeding for some period of time.
Gotcha.
I think I could do that with a short course of treatment. Certainly the other things, all the liver nuts.
Yeah.
All right, well then, she's already seen him, I'm not gonna get involved, but I agree with what you're saying.
Okay.
Just radiate and keep him comfortable.
Yeah.
Okay, cause his liver diseases, you can't do chemo with liver disease
Yeah,
like
because she
that.
said he's already level C, which is the highest.
All right, I'll
right.
talk to her, I'll call
Thank
Okay,
you.
so I mean, I think we could offer that.
her. You start
Um,
maybe Monday or
They
something?
should be able to if that's what they want, but now they're gonna talk to palliative care too, so,
Okay.
welcome back.
Thank you.
So, like I said, we can try to do something from a radiation standpoint, I don't think would be overly toxic. But it's about, like I say, 10 days of treatment, sort of a Monday through Friday thing. Or he could just do the palliative care option, but again, I agree with her, I don't think this is the thing that's gonna do him in.
Yeah.
However, he is having some significant side effect from it in terms of the bleeding.
Yeah, because he just used the bathroom a few minutes, well, about an hour ago, all over the bed, and it was more. I'm used to seeing the blood, and it's more blood than I've seen. So
but
it's getting like more and
it's
more.
not gonna, like say, it does not have that
Yeah.
kind of effect, okay? It does take a while, but with it, after we finish, I think that would slow down, hopefully.
Yeah.
But, about 10 treatments, I think, but now like I say, nothing is side effect free or risk free. You can have some irritative symptoms from that, you can have diarrhea, you can have some discomfort in there, it can affect his bladder where he has, burning when he
It's a
passes
blood
water
movement now.
and that sort of thing.
Yeah, they had the flex tube in, and it came out while they were doing the procedure downstairs, and the nurse was trying to see if they were going to put it back in,
Okay,
but she said there's no nothing in the system for her to reorder it.
okay. So, but anyway, you can hear what palliative care has to say today, and then, we can see him probably again, I'll come up, check him again Monday and then see, or you can have the nurses, if he decides he wants the radiation for sure, you can call, have the nurses call the department and let us know that. But,
Okay.
we certainly could, we could offer him that to try to slow the bleeding down.
What do you understand what he's saying? You can
Well-
do radiation. He can do radiation and slow the bleeding. It's not going to cure nothing, but it can slow that bleeding.
Yeah.
Or you can wait and talk to the palliative care and see what they say. Palliative care comes in before hospice.
Yeah.
Palliative care keeps you comfortable with medicine and stuff like that.
Yeah. Palliative care is what I look at. What you're saying now.
It's either you can do the radiation. You can choose. You could do radiation and still go with palliative care, or you have to do one or the or.
Well, hospice generally does not allow you to do a lot of radiation if you're
Okay.
on hospice, but, certainly prior to that, you can do, 10 treatments of radiation. But, again, they're not gonna keep him in the hospital just to do radiation.
Yeah.
So once you get out, then you would be bringing him back and forth and that sort of thing. So there is some, there's some of that.
Yeah.
It's a risk either way you look at it. What
I don't
comes up-
think the radiation is overly risky, okay?
Okay.
There's always risk to anything, but I would think what we're talking about would be fairly low risk, but now, anything is possible. You can damage the rest of your bowel and that sort of stuff with radiation, that's a possibility. It's fairly unlikely, but that kind of thing can happen, but
Yeah.
it's very unlikely.
Mm-hmm.
You want to talk to palliative care, and then if you decide to go with radiation, we call him back.
What would you say? What would be the
What?
diagnosis?
I would rather get the rest of the family, and
So that's
Sure.
more of a family decision, not a safety.
they on the way up here. I'll talk with them, and
Sure. I think that's reasonable, get everybody in, but, at the end of the day, it's gonna be his call. pretty
Yeah.
much. we can, you know, I mean, we certainly would be happy to try.
Because palliative care, there's nothing they can do to slow the
I
bleeding.
don't think there's anything they can do that's gonna slow the bleeding down. I mean, the only option we have for that is to radiate it. Now, is there some way, you know, I guess they could ask radiology if they could do some sort of embolization procedure where they would embolize, if they can detect an artery that the bleeding's coming from, they could embolize an artery. That's always, I guess, a possibility, but that would be something they would have to ask them. But I think the way to try to shrink it down a little bit and control the bleeding, I think the best way would be radiation.
No, that's
If
what
you
I was.
wanna, if you wanna do something.
That's what I was thinking, because that's the same thing. He's, you know, the oncologist doctor was down here. That was.
Sounds reasonable. Like that.
I mean, even if he gets sent home, I could. I mean, I'm able to bring him back and forth.
Okay. That's no problem. So,
Because that'll help slow the bleeding. It won't slow your pooping, but it'll slow the bleed. It'll
yeah,
help
that
the
I'm
bleeding.
afraid we're not gonna change, but it will hopefully cut down on the bleeding after, you know, hopefully within a week or so, and then, you know, about 2 weeks, hopefully it would stop and keep it at bay for some period of time. It's hard to know how long, but hopefully a while.
Yeah, because they're supposed to also call in a urologist because he's been having trouble urinating. He's making water, but it's like he feels the pressure, but he couldn't pee, so they end up having to put a Foley in.
Okay.
And I hadn't seen, we haven't talked to a urologist yet.
I'm sure they'll be around. So, you know, he can talk, it's not gonna hurt to talk to Pelvic Care, see what you think, and then, you can let them know, they can call us, or, you know, we'll check back in on Monday.
Okay.
You know, see what he wants to do.
All right.
All right?
Okay,
All right,
That sounds good.
Thank
Thank you
you,
so
Doc.
much.
talk to you later, bud.
I appreciate you talking to me.